So, welcome to this evening's program. Let's talk about it. The COVID-19 vaccine in our communities, hosted by the Meyer Cancer Center Office of Community Outreach and Engagement. After the videos, we'll have some really special content early in the evening. We will have a panel discussion to answer your questions about the vaccine. We'll be using the Q&A function seated at the bottom of your screen, rather than just using the chat function. And you will not have camera access during the meeting so that we can view all of the video materials prior. This is really just the beginning of a conversation. So there'll be some questions that we won't be able to answer by the end of the evening. But if the questions are too specific to your medical condition, it's probably best to consult with your primary care physician, especially if you're experiencing symptoms. We will share resources regarding primary care physicians at the end of our discussion and how to get connected with healthcare insurance if you're currently uninsured. Again, we will be using the Q&A function at the bottom of the screens for any questions. So let me start off with this very first video with a very close colleague, Dr. Kemi Babagbemi. She earned her BS degree summa cum laude from Georgia State University in 1994 and an MD degree following at Harvard Medical School in 1998. After training at Brigham Women and Infants for residency, her clinical interests as a radiologist are in women's imaging, primarily mammography, breast ultrasound, and breast MR, and ultrasound, including obstetrical and gynecologic ultrasound, emergency radiology, and cross-sectional body imaging, primarily CT. She was faculty scholar in health equity in 2003 with the Cornell Center for Health Equity and is very active in teaching radiology residents and medical students. Just in the past year, she became our inaugural vice chair for diversity, equity, and inclusion in radiology. Dr. Kemi Babagbemi will speak about her experience in participating in the COVID trial, the COVID-19 vaccine trial today. Let's start that video.
Hello, my name is Kemi Babagbemi, and I'm a doctor here at Weill Cornell Medicine. I'm actually a radiologist who takes care of women and their breast health. I am also an immigrant from Nigeria and a mother of two young children, ages 9 and 7. And today I just wanted to talk to you about my experience and why I chose to participate in the COVID-19 trials to make sure that the vaccines were useful for all of us. Just as a background about myself, in addition to what I've stated, I'm an asthmatic patient and someone with medical problems, but my whole family is also in the front lines dealing with COVID. My mother is a cleaning person in the hospital and refuses to retire and has been working throughout the pandemic. My 3 sisters are nurses on the front line, and another sister of mine is a hospital pharmacist. So just like many of you, during the months of March and April and May in New York, I watched with horror and fear as I saw people dying and getting very severely ill from COVID-19. Many of those people were people that just looked like me and were just like my family members. And sadly, like many of you, I know people who have died from COVID-19. I felt this great sense of doom and fear and helplessness. And as soon as I heard that there was something that could be done in terms of preventing people from getting this terrible illness, I decided to do my best to find out about it. One of the many things I read about was the vaccine development, and the vaccine that I later became a part of the trial for was the one that is made out of mRNA, one that was relatively new in terms of its use for vaccination, but I read that the technology had been here for more than 30 years. I also read that this vaccine was something that could be done very quickly with all the collaboration, but could still be done safely if we went through all the steps appropriately. One of the steps then was for people to volunteer to see if this medicine would work for all of us. And I say all of us because for vaccines to work, you need to include as many different kinds of people as possible. And being a Black woman, a Black physician, and somebody who I consider myself high risk for COVID-19, I thought carefully about my decision to participate. I talked to my family members, I prayed about it, and the right decision for me was to participate in the drug trial. And when this vaccine trial started, it was in September. I had no idea if I got the vaccine or not. I got my first shot, it turns out, in September, and the second shot in October. I found this information out in early January, and I was elated. I was so grateful that I, at all this time that I was sitting around, had already received the vaccine and I was doing very well. In terms of side effects from the vaccines, I didn't notice much more except for mild headaches and soreness, but I'm somebody who gets headaches anyway, so it didn't strike me as anything out of the ordinary. So as of my talking now, every member of my family who's on the front lines, including my mother, has received their dose of the vaccine and they're all doing very well. My sister actually got her second dose yesterday. So I would encourage you to ask the right questions, ask the right questions of the right people, and make sure you get your information from credible sources. And I encourage you that when your turn comes, I hope you'll consider taking this vaccine. I find it to be safe. I absolutely trust in the science, and I trust the people who develop the science, and I would encourage you to do the same. This is the only way out of this pandemic that I can think of for now, in addition to all the things that we're supposed to be doing, like keeping safe. So I encourage you to take this chance to find out more about it, have your questions answered, and strongly consider taking this vaccine. Thank you so much for letting me talk to you. I'm always available if you need to reach me for any reason. Take care.
So that was really wonderful and deeply personal. I think part of understanding how to get out of this pandemic and the situation that we're in is that we all approach it from a similar but also a very different place, in that we all have, our families, our kids, ourselves, sometimes our parents and cousins to think about, and it's a very personal decision. So part of all having the knowledge is also knowing how to make it right for yourself and right for your family. Kemi's story is actually similar to mine in that I was also a part of the phase 3 trial. And since then, I have had my mother, who's 87, vaccinated, my sister, and my niece, because they were all appropriate age and some with underlying conditions. But for my family, as a medical practitioner myself, it was my best advice for the way for my family to get out of this, but also for everybody to get out of it together as community. So with that, I would like to introduce our second speaker, also someone who I've known for many years, Dr. Susana Morales, who, like me, was born and raised here in New York. She attended public schools and then Harvard University for undergrad, and obtained her medical degree at Columbia College of Physicians and Surgeons. And that was the time that I got to know Susana first, and did a residency training, also internal medicine, at Presbyterian Hospital, again in the city of New York. She is currently an associate professor of clinical medicine in Weill Cornell Medical College, and is a longtime physician educator, patient advocate, and current director of the Diversity Center of Excellence, whose mission it is to enhance diversity in medicine and healthcare and to promote health equity through research, education, and advocacy, all in partnership with the community. And I would like to say personally, it has been said that in the past, Representative John Lewis was the conscience for the Congress of the United States. I would say here at Weill Cornell, Susana has become the conscience for the institution on many issues, particularly of health equity. And I am honored to introduce her here. And Dr. Morales will give us an overview of the COVID-19 vaccine.
Hello, everyone. I'm so excited to meet with you virtually today to provide a COVID-19 vaccine overview, something that we're all very interested in. My name is Susana Morales. I am a primary care doctor and an associate professor of clinical medicine in the Department of Medicine at Weill Cornell Medicine and New York Presbyterian Hospital. And I'm really excited to share with you today. We have a lot of questions. I think everyone in the country, everyone in the world really, about the COVID vaccines. We've all been living through a very difficult time with the pandemic. It's affected each of us. We are living through having personal suffering. Many of us have been ill ourselves or had family members or friends or colleagues who've been sick. Some of us may have even lost loved ones. And suddenly we received news of vaccines being rolled out. And many of us are trying to decide what's best for ourselves. So what I want to do is provide you with information, because I'll share with you, when I heard the vaccines were on the horizon, I promised my own patients that I would review all the information about the new vaccines before I would recommend them to anybody, and certainly before I took a vaccine myself. And so what I want to provide to you is a lot of the information that I've found out by reviewing the research about the vaccines, the history of this new type of mRNA vaccines, and other matters, and then answer some frequently asked questions about these vaccines. And before we proceed later to a question and answer period where we can answer your questions. But I'm hoping that a lot of the things that are on your minds are things that I address in this brief slideshow. So I think the first question that we all have is, why should I get vaccinated? Obviously, I just mentioned we are in the middle of a pandemic, but that's not really good enough, I think, for most people. Most people want to know, why should I get vaccinated? So obviously, the number one reason is to protect ourselves. But I believe also the reason to consider vaccination is to protect our families and our community, and to help end the pandemic. The reason for this is that it is felt by the experts, including Dr. Fauci, who everyone now knows, who's a world expert on viruses and vaccines, that unless a large percentage of the population is vaccinated, and we're talking about 8 out of 10 people at least, we're not going to be able to get out of this pandemic. And so for us to be able to return to a normal life where we're not living in fear, and we'll be able to have our normal activities, it's going to be really important that the population be vaccinated. But people need to have confidence in the vaccines before they decide to do it. And what I'm going to try to share with you is why I developed confidence and trust in these new vaccines. So, of course, the protecting ourselves part. Now, we know that when you get sick with COVID-19, God forbid, which is the disease that comes from the virus SARS coronavirus 2 or SARS-CoV-2, one of the challenges is that there are many symptoms from minor to major. It can be as simple as no symptoms at all, or maybe a little bit of a runny nose or a fever, cough or shortness of breath and difficulty breathing. And I think that's one of the things that people fear the most, because of course, a very severe pneumonia is one of the most serious complications of COVID. People can feel tired, can have stomach upset and diarrhea, or muscle aches or headaches. One of the really unusual aspects is the loss of taste or smell, or a sore throat. And then there are many other bad things that can happen, including neurological problems like strokes and blood clots, and many other complications. So as of today, and we're making this video on the 1st of February, there were over 26 million confirmed cases of COVID-19 in the United States. And as of today, COVID-19 has resulted in over 441,000 deaths in this country. So I think that we need to think about vaccination also to protect our families and our communities. So obviously a vaccine protects an individual, but it also helps to protect the whole community, partly because there may be people that can't get the vaccine yet. For example, children can't get the vaccine yet, or young people. And as of today, it's only mainly for people over 65 and some frontline workers. So vaccination can help to protect the whole community. So how do vaccines work? A vaccine works by showing your immune system what a piece of the coronavirus looks like. It's like a mugshot of the coronavirus, so that if the real coronavirus ever tried to enter your body, it would be recognized and attacked by immune cells and antibodies. The mRNA vaccines have a code in them that codes for this spike protein, the ugly little spike protein that you've all seen that's on the surface of these coronaviruses. And the vaccine does not contain any live virus, but it does contain the code for the spike, because if you inject that code in, the body can then learn to recognize the code. And if a real coronavirus shows up, it attacks with antibodies and cells and kills the coronaviruses. That's the bottom line of how this vaccine works. So one of the big questions is, how do I know if a vaccine works and if it's safe? And the thing that there are a couple of pieces to this that are important that I learned. First of all, and one of the, that I would say that that's the number one question that people have: is it even going to work, and is it safe? And how do we know it's really safe? Because one of the concerns that people have had is that it was created much more quickly than usual. So the number one thing for people to be aware of is that every single drug or vaccine that's invented has to go through what's called a clinical trial. And the Food and Drug Administration, or FDA, has mandated exactly how these trials are done. And they basically have 4 phases. And the first phase just has a few patients, 20 to 100 volunteers. The second phase has several hundred volunteers. The third phase has at least 1,000 volunteers. And the fourth phase is after a vaccine or a drug is approved, you still follow what happens to the patients. So the COVID vaccinations that have been approved so far went through all these phases before they were approved. So there are 2 vaccines that have been approved so far. There are dozens more in the pipeline. We don't know yet if they will be approved or not. So I'm only going to be speaking right now about the Pfizer and Moderna vaccines, which have been approved as of today. The most important thing for you to know is that they are very effective, more than 90, almost 95-ish % protective. The Pfizer vaccine studied 36,000 people that were in their trials. Half of them got the vaccine and half of them didn't. That's how you do a trial. You compare half of the group that's received the drug or the vaccine to the other half that didn't. And what they found, and the thing that was most important to me, was that of the people that got the make-believe vaccine, just salt water in a syringe, 162 of those people got symptomatic COVID. But of the people that received the vaccine, only 8 people got COVID. And of those people, only 1 had serious COVID. So it wasn't 100% protective. It didn't prevent every single person from getting symptomatic COVID, but it decreased the risk massively. So that is where the number 95% came from. And the Moderna vaccine is similar. It also studied thousands and thousands and thousands of patients. So some of my patients have said, well, I want to see somebody else get it first. And I tell them, well, actually thousands of people have had it as of the end of the trials. Of course, now there are millions more that have gotten it in America and around the world. But in the Moderna trial, again, the people that got the make-believe vaccine, just the salt water, 90 of them got symptomatic COVID. Of the people that got the vaccination, only 5 got symptomatic COVID, and none of them were severe. So that is a very powerful result. That is better than almost any other type of vaccine that we have that we're all already used to. That's pretty impressive. When I read those results, I was pretty excited. But I also wanted to know, was there any risk? Is it safe? Was it made too quickly? Were there shortcuts? That's what's out, that's what people are saying. So the things that I discovered is, number one, that these vaccines are based on decades of research for similar vaccines. mRNA vaccines are a huge step forward in vaccine science because of many factors, which I'll go into, but most importantly, that you can make them quickly so that when you have a new virus or a new virus strain, which is one of the things that we're handling right now, you'll be able to make new vaccines quickly without, millions of people dying. So when I looked back, these mRNA vaccines have been studied for Zika, have been studied for Ebola, and have been studied for the other previous coronaviruses that we've confronted. Some of you may remember MERS and SARS. Those are other coronaviruses that also were very dangerous. They didn't reach epidemic levels like COVID has, so they didn't need to roll out those vaccines. But this method was studied, and so this current couple of vaccines was built on the shoulders of those other research projects. And when COVID hit the world, many of the hundreds and hundreds of vaccine researchers from around the world stopped what they were doing for other things and turned their attention to making a COVID vaccine. So that kind of brain power, financial investment, because billions of dollars were put in to support these new vaccine efforts, were part of the reason also that things could be done quickly. And as I'll show you in a minute, there were also some timelines that were overlapped. But whatever happened, all of the same safety standards were followed, and all the same expert reviews were used, as always has been done with other vaccines. So everybody is aware about this whole idea of, traditional vaccine timelines have been up to 15 years sometimes, although some of the more recent ones were down to maybe 4 or 5 years. So there's usually a backstory of a lot of years of research where they try to find new methods for these new types of viruses. And then, as I showed you, the human phases of the trials are done in sequence usually. First they do phase 1, then they do phase 2, then they do phase 3. That takes many years to finish. And they then ask the FDA and the CDC to review it, and that can take years, and then they produce everything. What they did with the COVID vaccines is the following. First of all, they started running the human trials at the same time. A couple of things helped that happen. Number one, you had thousands of people step forward to volunteer, including some of our own friends and colleagues, because this was known to be such a terrible virus. About 1 out of 4 of the volunteers were healthcare workers, including workers at our hospital, including physicians that I work with. In addition, unfortunately, during if you don't have a pandemic, it may take a while for like a regular person to be exposed to the thing that you're trying to protect again. Let's say you're making the vaccine against Zika. Maybe there isn't that much Zika in the community, and it's going to take a long time to get enough cases to really know if you're protecting against it. But unfortunately, because of the pandemic, many cases were happening. So you could show very quickly that it was effective. So they were able to compress this part of things into months. In addition, what the billions of dollars went in part that even before we knew if the vaccines worked, they said, let's start producing. So that the moment that a vaccine worked, you could ship it out. And that's exactly what happened with the COVID vaccines. Overnight, we heard that they worked, they got approved, and suddenly you heard they're available. And then the approval part, which can take a couple of years, they had lined up all their experts way ahead of time so that the moment that they had the results and that they opened up the secret to see did it work or not, because they don't tell you until after the experiment is over. Even the scientists themselves don't really know what's going to happen until they kind of break the lock on the study. Then the scientists that are experts in vaccines would be able to review the results very quickly. So instead of it taking years, it could be done in weeks. So some of the other questions that people have about, does it protect me? Is it worthwhile? Is it appropriate for me? I've already been infected with COVID-19. Should I still get the vaccine? The experts say yes, because some people have already been shown to be able to get infected more than once. And it is felt that the vaccines will hopefully provide better protection than just having had the illness alone. One of the other questions people have is, do I still need to wear a mask? Or am I 100% free of any restrictions? Which is, of course, where we want to be someday. At this time, we still need to mask. We still need to exercise precautions, because right now we do not yet know if the vaccine prevents all infections. It is possible that even if you're vaccinated, you could get infected and be asymptomatic. We know now that a lot of COVID infection is asymptomatic. And so because of the risk of spreading it to other people, you still have to exercise the same precautions. What I'm telling people is, until Dr. Fauci tells us we can stop wearing masks and stop exercising precautions, we all still need to do that. But it is extremely helpful to know that the vaccinated people are at much less risk of getting very sick. The other question is, how long will the protection last? We do not know yet, but the scientists are studying this. A couple of things related to this are about the new strains. We don't know for sure whether the current vaccines will protect perfectly against every new strain that happens, but it is still felt that as many people should get vaccinated as possible with the vaccines that we have, because one of the ways that all these mutations happen and make new strains is because it's spreading like wildfire through the population. The less it spreads, the fewer new strains, the easier it is going to be to end the pandemic. A couple of other comments about, is the safety profile relevant to me? It's really important to know that, as I showed you, the vaccines were tested in tens of thousands of people, including minority people, healthcare workers, older people, including people up until their 80s. The Pfizer one started at age 16, the Moderna one started at 18. And there were no significant safety concerns identified in the clinical trials, because that is the first thing I look for. Did the vaccine kill anyone? And nothing in the clinical trials showed that the vaccine killed anyone. They did gather safety data over at least 8 weeks. And that seems really short to people. And I wondered where they got that from. And then I researched this, and it turns out that it's very unusual for any significant side effects to appear more than 8 weeks after a vaccine. That's been a question that some people have had. How do you know it's not going to cause long-term side effects? The reality is that vaccines extremely rarely cause long-term side effects. You hardly ever see that. If there are going to be any problems with vaccines, they come out quickly. Another question that people have had is it going to interfere with my DNA? These are RNA vaccines. It's a different kind of genetic material. It's not from an actual virus. There's no live virus involved. It's just the code that copies the code for a spike protein. And so these vaccines can absolutely not give anyone COVID-19, and they don't go into the cell nucleus, and they don't interact with DNA. So what can you expect after getting the vaccine? Your arm may hurt or might be a little swollen. The most common side effects, which the majority of people didn't necessarily have, were fatigue, muscle aches, headaches, chills, occasionally fever. Some people seem to have more symptoms after the second dose, but these side effects are normal signs that your body is building protection, that your immune system is responding. And for those of you that are parents, you know that the day after you take the baby to get a vaccine, they may have a little bit of a fever, or they may be cranky. That's probably because they're feeling a little achy and unwell. But that's a known impact of doing something to tickle the immune system enough to provide, in the case of your baby's protection against childhood diseases, and in case of the COVID vaccine, you from protecting you against COVID. So we know you have other questions. We want to give you all the information you need to make a decision to empower you about whether or not you want to have the vaccine. A few other things that people have asked that I do want to address. What's the difference between the Moderna and the Pfizer vaccines? Very little the answer is very little in terms of how they're made or how they work. There's a slight difference in how they're stored. So the Pfizer one needs to be in that really super freezing freezer. The Moderna one, it doesn't have to be quite as cold. The Pfizer one, it's a 3-week difference between the first and second dose. The Moderna one is 4 weeks. But other than that, they're pretty identical. How long does it take to work? Usually about 14 days after the second dose is when you're felt to be immune, or as immune as you're going to be against serious COVID illness. What if I have allergies? So that's something that came up after the vaccines were started to be given out. Part of the reason for that is that they decided not to allow volunteers that had had very severe allergies. And when we're talking about severe allergies, we're talking about something called anaphylaxis, which is the type of allergic reaction where you have your throat swell up, your mouth swell up, you end up in the emergency room. It's treatable, but it's a serious thing. If you've had anaphylaxis, you would know it, and you would probably have been told you should carry around what's called an EpiPen, an epinephrine pen. So the people that have had anaphylaxis have been told that they should bring their EpiPen to the vaccine site. They should tell the people at the vaccine site that they've had this experience, and they are watched for longer after the vaccine. I've had at least 2 of my own patients who have a history of anaphylaxis who've been vaccinated. Both of them are healthcare workers, and they have not had any problem, but it's theoretically possible. One of the big things that's out in the community is, I'm afraid to get the vaccine because I've heard it causes infertility or affects your sexual function. I'm not sure where exactly this comes from, but they did not enroll pregnant women in the vaccine trials, mainly because you don't usually enroll pregnant women or children in a vaccine trial before you've proven that it's safe and effective in non-pregnant grown-ups. But whatever the case, there is no evidence that the vaccine causes any problems with infertility or with sexual function. And in fact, COVID can harm pregnant women and can cause problems with sexual function. So the disease itself is what's dangerous for fertility and sexual function. Will it change my DNA? As I told you earlier, it cannot. Will the vaccine give me COVID? As I said earlier, it cannot. What if I'm pregnant, breastfeeding, or planning to become pregnant? As I said, the studies were not done in pregnant women. Our chairwoman of obstetrics and gynecology at New York Presbyterian, Dr. Laura Riley, recommends, she's an expert actually in infectious disease in pregnancy. She believes that because pregnant women are at much increased risk for getting very, very sick or even dying from COVID, she recommends that pregnant women be vaccinated. But if in doubt, it's useful for you to consult with your own doctor. There's no evidence that there's any harm to a baby if the woman is breastfeeding. And again, if you're planning to become pregnant, there is no evidence that it would harm your ability to conceive. There were some women that got pregnant during their participation in the clinical trials. What's basically happening is that women they're looking at the registry of women to see what happens in pregnancy to vaccinated women, but there is no evidence that it's harmful. Will this vaccine hurt my community? First of all, I want people to know that a very diverse scientific community came together to make these vaccines. And one of the things on a personal note that I'm very proud of is that two of my former residents, a Haitian American woman, actually, Dr. Judith Absalon, and a Latino guy, Dr. John Perez, were part of the senior science team on the Pfizer vaccine. And they were my residents when I was a Columbia faculty member. So I'm just delighted that they've been part of what I consider to be, saving the world. And the Moderna vaccine some of the clinical trials were at New York Presbyterian, run by another one of my former residents, Dr. Christy Marks, in our Division of Infectious Diseases. So, I think part of the thing that I personally benefited from is that I know these people, I trust them, I trust their integrity and their intellect and their brilliance. And I know, I really feel confident that they are people that are trustworthy scientists and that are very much interested in helping humanity. I mentioned that the vaccine trials included a diverse population. About 20 to 30% of the people that were studied, that were volunteered for the trials, were African American, Latino, Asian, so that it was studied in different parts of the world and many states in the United States. One of the issues I think for communities of color in America is that communities of color in America right now suffer from disparities in how we are treated in the outcomes of our healthcare. There has been abuse of poor communities, minority communities in medical research. So it's completely understandable that there's a lot of distrust. That's why it was important to me that the highest level of carefulness and attention was paid to having diverse patients, diverse researchers, and really careful administration of these vaccines. And on a personal level, again, we also know that although everyone in the world is suffering from COVID, that proportionate to our representation in the population, African American and Latino people have suffered greatly because we're frontline workers. It's harder for us to work from home. We live in, we have bigger families. We're frequently a little bit crowded in our housing because rent is so expensive, and a lot of our communities are lower income. There's a lot of different reasons for this, but the bottom line is that our communities have suffered greatly. And it's really important to me that we stop that suffering and get back to normal. And I personally do feel that one of the ways to do that is by our community getting vaccinated. So I think that the vaccines are a light at the end of the tunnel. It will take time for people to be vaccinated. And we know that there are new things that unfold, like some of these new strains. So in the meantime, we must keep doing what we know helps. Washing our hands, maintaining physical distance, masking, being careful about checking our health daily, and if we're sick, staying home, and of course, covering our coughs. So I wanted to show you the day that I got my vaccine. I was pretty ecstatic, and I almost burst into tears. That's why I look kind of serious. Plus, I mean, it's hard because I'm all covered. That was it. And after I got my vaccine, I danced. So thank you for your attention. And our team that's going to be with you today will be taking questions that you may have. And good luck to you. God bless. Stay safe.
Hello, everybody. Can you hear me? I'm back. First, I'd like to have my co-panelist turn on your video so we can introduce Dr. Easterling, if Dr. Easterling is here. Oh, fabulous, fabulous. Okay, Dr. Easterling, we haven't met yet, but I've heard a lot of great things. So I hope I get everything correct in your introduction. If there's anything that's a little bit off, please just jump in and then we'll answer some of these questions together. So it is my great pleasure to have someone from the New York City Department of Health and Mental Hygiene, because I think that we're seeing a lot of like a broad swath of questions. I want to make sure we're looking at it from the Cornell provider perspective, but also the Department of Health, because I think many different perspectives are needed in order to answer all of the questions and for people to have some semblance of where we're coming from, right? So Dr. Easterling serves as the first Deputy Commissioner and Chief Equity Officer at the Department of Health and Mental Hygiene. He spent more than 5 years in a senior leadership role at the Health Department, and prior to serving as the first Deputy Commissioner, he served as the Deputy Commissioner for Community Wellness at the same New York City Department of Health, where he oversaw programmatic work focused on reducing overall premature mortality and closing the racial gap on the top leading causes of preventable death. He also served as Assistant Commissioner of the Department of Health Bureau of Brooklyn Neighborhood Health, where he helped advance key programming to address pressing concerns, including maternal deaths and gun violence. But Dr. Easterling is also a community physician committed to health equity, social justice, and movement building to achieve the health outcomes that all people deserve, both locally and globally. Dr. Easterling holds a Bachelor of Science from Morehouse College and a Doctor of Medicine from Rutgers, New Jersey Hospital, and Masters of Public Health from Mount Sinai here in New York. He completed a residency in family medicine at Jamaica Hospital Medical Center in Queens and a general preventive medicine residency, again at Sinai in New York. So thank you, Dr. Easterling, for joining us. So I can see that some of the questions have sort of gone over to chat, but we're trying to answer all the questions through the Q&A function. One of the questions in chat I just wanted to start with, to be very clear, because this is something that I share with Dr. Babagbemi, which is being a part of the phase 3 clinical trial. When we were both a part of the trial, which happened in September and October, we didn't know whether the Moderna trial was going to be 30% effective, 50, or 95, or really, but what we did have and what we shared was the same trust that Dr. Morales had in her various trainees who had a part of putting together the trials, but also were very important in the biology behind it. And so taking that, well, one would call a risk of being part of the phase 3 trial, was because we were seeing the disproportionate impact of COVID in our communities. So part of being a part of the trial was for our own potential safety, but also because it was very important that these trials include people of color within the trials, so that when it was finally done and they said it was 95% efficacious, they would know that it was efficacious in all people of color, women, men, Latino, African American, Afro-Caribbean, these were all people who were going to be in that bubble of 35,000 or 45,000 people who could say how effective the Pfizer and Moderna vaccines were when it was finally said and done. Now we've had a period of time where several million people now have had the vaccines, and we can go on to answer some of those questions. So let's go to the Q&A. Okay, so I'll start asking what are the questions, and I guess any of one of the panelists can also pick up. So first question is, can I have the vaccine after giving birth in November of 2020? And I'm also breastfeeding. So I first want to say congratulations. And then after that, I'll hand it over to one of my panelists, perhaps.
I can answer that. Certainly, a non-pregnant person is the type of woman that was enrolled in the trial. But as I mentioned in the video, many people feel that pregnant women should strongly consider being vaccinated because of the risk to pregnant women of COVID. That COVID is much more serious in pregnancy. So there is no evidence that there's any, in terms of nursing, there's no evidence that there's any problem with nursing when you've received the COVID vaccine, so that should be perfectly safe. And if in doubt, obviously a pregnant woman should talk about it with her doctor. That totally makes sense.
So Dr. Morales, I'm going to ask you for the follow-up because it's very similar, and you actually talked about it in your video, which is, will this vaccine cause infertility in women?
There is no evidence that there's any problem with infertility in women from this vaccine. That issue is making the rounds. I think partly because maybe because pregnant women weren't part of the trials. There is also a story going around that there's something in the placenta that's similar to something to do with the vaccine. It's not 100% clear to me. Basically, it's a myth. One of the big challenges, I think, for everyone right now in the world, and definitely in America, is sorting out accurate information and mistaken information. Now, that said, what I've learned from thinking about the vaccine issue and talking to a lot of people about it is that much of the time, the questions that people have are based on something, maybe like a little kernel of truth, but then it gets transformed and just sometimes distorted. Although there are also things that are just frankly flat out not true. So of course it's normal for people to worry about long-term effects and effects on fertility, but there is absolutely no evidence of that.
Thank you. This next question I'm going to throw to the panel, perhaps Dr. Easterling wants to tackle this one. Are there any adverse effects on people with diabetes? There have been numerous rumors that the vaccine may cause significant side effects for people with diabetes.
Great. Thank you so much for having me. First and foremost, I'm so happy to be joining Dr. Morales. Dr. Morales, I need that video to record it. That was pretty awesome.
Thank you.
But to the question, no, there are no specific adverse effects on people with diabetes. Dr. Morales really laid it out for us and how important it is, particularly for individuals with underlying medical conditions, people who have immunocompromised, conditions, that the benefit of getting the vaccine certainly outweighs the risk of getting COVID. And so certainly really important. There's just more that we need to learn about the vaccine and, certainly the longevity of the protection. But certainly what we know from the clinical trials and what we've just heard recently this week is that, we continue to see that there's no serious safety concerns. As you already heard earlier, there have been no deaths reported. Anaphylaxis reactions are happening, but are very uncommon across. And the most common reactions that folks are experiencing are local reactions to where you're getting the injection, as well as, maybe sort of that tickle, as Dr. Morales said, or sort of the reboost of your immune system, where you can be experiencing fever or low-grade fever or headache or dizziness and things of that nature. Those are the most common side effects. But the safety profile of the vaccines certainly have been shared and very clear.
I think I forgot to mention one thing in the video, which is relevant to this question, is that besides the diversity of race and ethnicity and age, there was a lot of diversity in medical problems. At least 10% of the people that were in the trials were diabetic. A large percentage had hypertension, obesity, chronic lung disease. They didn't just put healthy people in the trials. They put people that looked like the world, that had sicknesses, partly because they wanted to make sure that there wasn't going to be a problem with sickness. The only type of underlying medical problems that they tried not to have are people with on severe big gun immunosuppressants, or people with severe active cancer, because they didn't want it to sort of interfere with their treatment. But other than that, they're very, very similar to the general population. And there was nothing reported that was anything, no problem with diabetics. That's not true.
Yes, and to sort of tag along with that, the Johnson & Johnson vaccine, which is on the cusp of being approved, maybe one of the panelists could correct me, also had a couple of cohorts in their international wing who had HIV and were actually immunocompromised. So the trials here included diabetics and a lot of people with underlying, and some of the other newer vaccines are also including patients who have other underlying conditions. So these things are all being thought through. One of the interesting pieces of data that's starting to come in is that people who already had COVID prior to vaccinations sometimes have more reactions to the first shot. Like they'll have more headaches or arm pain. But what they're finding is that people who have had COVID in the past have even more antibodies than anyone else when it's all done. So the recommendation was to give people the vaccination, whether they had COVID or not, because of reinfection. But it turns out that people who have had COVID before, who have the vaccination, have way more antibodies than anyone else. And it's presumed that means that there's even more coverage. So that was an aside. So someone said thank you to one of your responses. I don't know if you saw that, Dr. Morales. Okay, so next question. Everyone tells us to talk to our PCP, but most of them are non-committal because they don't want to be blamed for telling you to take it or not. Who can we really trust for a straight answer, and are PCPs being trained with information? That's a big one. Okay, who?
Yeah, I think we both should take it. I think that this is a really important question. And I know that there are certainly concerns, and we have to be transparent that physicians, clinicians are concerned as well. They come from the same communities that we're doing outreach in, that, folks who are in our healthcare systems are coming from the same communities that have been disproportionately impacted, who are calling for PPE and making sure that they had the right resources. And so we have to start from a place that hesitancy does not just fall in one group. It is not monolithic. It is certainly across the country. It is in every community. And so we have to acknowledge it and also validate it. I think that that's really important in addressing vaccine hesitancy and just building more confidence around vaccines. And so with that being said, certainly we have to trust the information that's coming from, starting with the manufacturers of the vaccine, the Center for Disease Control, and certainly from the health departments, because that's where we're getting the information. Our, as providers, we are certainly, we can fall prey to misinformation, disinformation, just like anyone else. Just because we have a medical background, we can certainly fall prey to it. So we are working with our providers. We're making sure that We're reaching out to them, giving them the information. We have webinars that we do on a weekly basis with providers across the city. We are talking to our professional organizations as well, supporting the providers to make sure they're armed with this information. Many of the providers are also joining our speakers bureau, and they're doing community conversations as well. But the important part is really having this information and being steeped into the data, which, Dr. Morales and I have really been looking at this, and also supports the reasons why we're vaccinated today, and we can comfortably say that we've already been vaccinated. And certainly we have to understand why someone else, is not vaccinated, why they have the concerns, and that can include a physician as well.
Yeah. As a primary care doctor, I'll tell you, I feel strongly that people should be vaccinated. But the part of the dilemma is, I don't think that, we were just Dr. Easterling and I were just in another meeting, and this is what part of what we were talking about. We're not neutral necessarily. We do believe in vaccination, but we also believe in empowerment, and so it's interesting that you're saying that the doctors are non-committal and won't tell you what to do. And one of the things that we talk about is how if you try to twist people's arm to do something, then usually they're going to try to do the opposite thing, number one, and that you have to be respectful of people's feelings about things and try to meet them where they are. So I suspect that there may be physicians that are also not fully convinced, but I think some of that may also be people trying to be respectful of where you are in your journey. It's interesting. So I'm not non-committal. I do believe in vaccination, but I believe also in respect.
Thank you very much. I'd actually like to take this particular question. So I'm going to ask it and then answer it so we can get to some of the others. And so the question is, why was the use of hydrochloroquine banned from being used as a drug that could help with COVID? Okay. So in the very beginning of when this started, hydrochloroquine had a couple of publications that were put out, and everybody was optimistic, hoping that it could actually work. I was one of them. I really hoped that it could work because it was a drug that was generally available. But then the studies were done, and large studies, many studies, and they did not find that hydrochloroquine was of any value. So it does not help treat COVID. And in fact, in a small percentage of patients, it might be harmful, right? So it wasn't really banned. It was just that it doesn't work and it actually might hurt somebody. So then people moved on to things that might help. And so there've been many things along this path where people are hoping because people are hurting, right? So everybody hopes that things work. People have hoped that, zinc and vitamin D and all of these different things will have an impact. And they just haven't been shown to have the kind of impact that very clearly these vaccines do. And that's why, as Dr. Morales said, we're not partial. I mean, we really think that people should have them, but at the same time, you can't twist people's arm because you have to respect people, right? So, in this particular case, my son's therapist early on in the process died of COVID, right? And so his newer therapist a year later is like, I don't think I want to do it. I'm not sure I want to wait. And so everything in my body says, hey, no, you need to get out there right now. In fact, I am going to walk you somewhere and they're going to vaccinate you. But, it also is his body. And I know that saying that will make him probably never call us again. But, I have to respect his feelings and have a very long conversation with him about all of his questions. And I will do that, just like I'm doing here tonight. So let's move into the next question, if I answer the hydrochloroquine one correctly. So, next question. What are the long-term physical and psychological effects for persons wearing masks for long periods?
Nothing that we know of. I mean, this is something that we're going to have to continue to look at the data. Certainly, I think when we just talk about overall well-being, we're not seeing any long-term physical or psychological impacts. And certainly, we've actually updated most recently, we just updated our mask guidance, making sure that people know how important it is, given the presence of new variants, that they're protecting themselves from COVID. And so our guidance now is really making sure that if you're going to use a single mask, that it is double or triple layered. If you're going to use a temporary mask, paper mask, then you should also have a cloth mask, in front of that temporary mask. So we've updated, and particularly if you have underlying chronic conditions or a senior, using a KN95 is also important. N95 should be reserved for our healthcare workers.
Okay, I'm going to answer this one rather quickly because I think it's just a very technical answer. So why is the second dose for Pfizer 3 weeks apart and the Moderna dose is 4 weeks? Well, honestly, that is how it was studied through the different phases of development. So they picked 3 weeks because they felt like there would be a good antibody response, this is Pfizer, to the booster dose 3 weeks later. But honestly, it probably could have been 3 weeks and 3 days, maybe even 4 weeks. But 3 weeks is what they settled on early on the trial, and it worked. And Moderna had settled on 4 weeks based on some early, basically phase 0 scientific data. But both seem to be very effective in having a antibody response between 1 and 2 weeks after the second dose, and they're fairly similar in the way they work biologically. Very informative for the public. The big question as a patient at Cornell, why can't we get the vaccine at Cornell?
I can answer that one. The issue of vaccine access in general, and maybe Torian and Kemi, I think you may want to answer also about your own family, about how all of you were healthcare workers, which is why I know you were eager to respond to that as well. But in terms of the supply that's available at NewYork-Presbyterian's network, one of the challenges is that the main supply is up on the 168th Street campus in the Armory, which is a hassle for a lot of people to get to. Although they are vaccinating, and they just opened up access for people under 65 with underlying medical conditions. So if you are a NYP patient, you should be able to go online or call to request being added to the vaccine list. But Dr. Easterling can mention in a minute about the New York City's access points. But Kemi, did you want to respond to this issue of healthcare workers and how all that came about?
Yeah, thank you, Susana. I wanted to specifically clarify that my entire family is all healthcare workers in the front line. So I have 3 sisters who are nurses here in the United States, and another sister who is a nurse in the United Kingdom, all of them frontline COVID workers. And my mom is a certified nurse assistant and also hospital custodian who cleans COVID floors. And then I also have a brother who's a medical assistant. So the reason we got it, because they got it actually, was because they were phase 1A, met the criteria and received the vaccine because they were front of the line according to that criteria, and they were in Boston and received it. And I also wanted to show proof of life. I'm almost 6 months out from getting the vaccine, and I'm just doing great. So wanted to add that to it too.
Great. Yeah, I just wanted to add on to this point that Dr. Morales had mentioned around supply. So supply is absolutely limited. I mean, this is why we're prioritizing individuals who are getting the vaccine at this time. We knew that supply was going to be limited. We do not expect that we'll be able to get to the general public until about mid-2021. We'll have enough supply where if you want the vaccine, you can just either go to your physician or go to your healthcare system or to a city-run site. So because we have supply, and I do see that the question is about the eligibility, we are, the allocation is going to specific locations. First, the supply started off at healthcare systems, really focusing on high-risk healthcare workers, expanding to all healthcare workers, as well as to long-term care facilities, nursing homes for residents and staff. And so, now we have expanded to additional groups, people over the age of 65, frontline workers who are, driving cabs, who are restaurant workers, who are teachers, who are childcare center staff. And now we're also including individuals with underlying medical conditions. And so with this large population, we still do not have enough doses to get to everyone who's eligible now. There are more than 4.5 million people in New York City who are currently eligible. We do not even have 2 million doses in the city. And so the locations that have already been allocated, some of them have been prescribed which groups they needed to start with. Hospitals started with their workers, and then they moved to their patients. So as Dr. Morales is mentioning, yes, patients can begin to schedule appointments at their healthcare systems. Our city-run sites, and so we have 15 hubs that are now located in high schools across the city in all 5 boroughs. Primarily, we're starting off with many of the eligible groups that include seniors, that also include certain workforce, and so teachers, restaurant workers, et cetera. But then there are other sites like the pharmacies who are really focusing on their seniors. We need to make sure that our seniors are getting vaccinated. And then as seniors are getting vaccinated, they're going to open up to additional groups. And so this is a way that we can prioritize those individuals that if they're exposed and they stand to experience the worst outcomes, severe illness and death, we want to get them vaccinated first. And then that's how we're going to continue to expand out to additional groups. So that's why you see certain locations are limiting their allocation and doses to certain populations at this point.
Dr. Easterling, can you actually see the questions in Q&A?
Yes, sir.
Okay, because I was going to say, you're knocking out all the questions, like what before they're even coming up, which is great, because someone wanted to provide an update on who's eligible to take the vaccination now that they have, but you basically answered all of that, which was really very helpful. There is actually one question in Q&A from someone who's looking to see whether their church within an impoverished community can become a vaccine site. I think they're starting to open up a number of different borough mass vaccination sites, but perhaps you would be able to provide how churches are going to fit into those mass vaccination sites.
Yeah, I would say, right now, the state has really been focusing on ways to get pop-up vaccination sites at local churches. So I can certainly direct you to the right contact at the state level. At the city level, we're looking at our doses as we're continuing to allocate doses to all of the specific locations that I've already alluded to earlier. Certainly want to start to think about how we're going to be supporting local churches as well in New York City. So certainly you can follow up with me and I can direct you to the state for now. It's the best thing.
So there is one question that I'll answer very quickly because I'm not sure there is a specific answer yet, but perhaps if any of the panelists know, they can back me up. The question is, would there be any medical problems if a person gets 2 different vaccines? First dose was Moderna and the second dose was Pfizer. It has happened, right? So it's clear it was going to happen. It was just a matter of time. but I haven't seen any reports on, I mean, I would doubt there are any serious medical problems, but I haven't seen anyone report on a group of patients who have had mixed doses. Has anyone seen anything?
No,
I don't think it's an issue. Oh, sorry.
go ahead, no, go ahead.
I don't think it's an issue that it's a problem. The issue is, will it provide the same level of immunity as having two of the same? There's actually a study going on right now to see whether they're interchangeable, because they are very similar, the Pfizer and Moderna, but the answer to that is not known. So right now, the feeling is that as much as possible, one should stick with the same one for the second dose.
Yeah, that's right. Yeah. Yeah, I mean, the CDC has already stated this, like, we should really make sure that your second dose is the same manufacturer as the first dose. Here's the scenario. CDC has said in extreme situations, if you are choosing between getting your second dose on time and trying to get the right second dose at the same manufacturer as the first dose, you should get that second dose. So if that second dose happens to be Pfizer and your first dose was Moderna, and if you cannot get to a Moderna vaccine in time for your second dose, then just go ahead and get that Pfizer. You know, those are the extreme situations, and really also thinking about limited supply, and particularly rural areas where we know that supply is particularly limited in certain locations. So, but I think, you know, where we are right now, we've allocated our second doses based on the first doses that are being allocated. So in New York City, we have our second doses. So people should be getting the same manufacturing vaccine as their first dose.
So I'm going to answer this particular question because I was looking up something over the weekend that was relevant. It's a pretty technical question. So I understand the vaccine recognizes the spikes that are on the surface of the COVID virus and attacks it. Are the spikes only present on the COVID-19 virus and does not appear on anything else in our bodies, or could enter our bodies that the vaccine will recognize and attack? Okay, so I was curious about something similar, so I read a paper about it. So what people have been concerned about in the scientific community is whether the antibody that recognizes the current spike protein will also recognize the spike protein of a variant. So they've been looking at the structure of the spike protein normal and the spike protein variant, and have been trying to work on whether the antibody might see both of them. So it looks like the antibody is not quite as good at seeing the South African variant, but it's okay. The likelihood of having something that similar in our bodies as a protein is fairly small, but completely unknown. But it's really unlikely that anything in our bodies looks like a viral spike protein, to answer your question. But it's very technical, and I don't think anyone is quite there yet.
So I wanted to answer one of the questions about fetal cells, because that I've heard that a lot, that people are concerned about. So one of the things that's making the rounds is whether or not the cells of an aborted fetus were used to develop the COVID vaccines. So first of all, the answer to that is no. The Pfizer and Moderna vaccines do not use any aborted fetal cells. But it's important for people to know where this comes from, and part of where this, I think, comes from is this notion of what's called stem cell research. And stem cell research is the research that's done for many, many, many aspects of medicine, and this is related to cells from about 50 years ago that were donated from people that were doing in vitro fertilization, that donated embryos that they did not use to conceive their baby. They donated them to medical research, and that's where stem cells come from. And so there are things in science that use stem cells for cancer research, for all kinds, HIV, for all kinds of really important research. But it is not the case that aborted fetuses are being used for medical research. That's not true, and it's certainly not true for the COVID vaccines.
Okay, so I'm going to be respectful of everybody's time, and there are some really good questions and follow-up that has ended up in chat, and we'll try and contact everybody, provide contact so that you could ask any follow-up questions about eligibility or anything that comes up, because it's always when the webinar is over that you come up with the best question, right? And that's just the way things work, right? So we're here for any follow-up questions, and we'll make sure that's available. But there was one open question in the chat, but it seems to have gone away. It was just someone asking whether a 36-year-old is likely to get a vaccine soon. And I presume this isn't someone with no underlying conditions or within the priority list that Dr. Easterling set out, I guess. So presuming that's the case, I think that the best guess for when everybody who's not in the initial priority groups will be able to get a vaccine is probably by early summer. But there are so many different variables that one has to throw in there. We're making the presumption that Johnson & Johnson is approved and widely available, that there are no manufacturing issues, and many other distribution things. Like, no one really presumed that there was going to be a horrible, storm for a whole week that was going to change the number of vaccinations that could be given around the country. But that happens. I mean, life does happen. But based on the very aggressive timeline that they've had and the number of really effective vaccines, I would say most people in the country who want one are going to be able to have a vaccine by early to midsummer. Is that fair from what everyone else is hearing?
That's correct.
One of the questions, are we ending now, Joe?
We're ending in about 2 minutes.
Okay, one other question that's in the thing that I think is important. Somebody asked how long the immunity lasts from the vaccines. And the answer is we don't know yet. But because it is possible, just like the flu shot, that we may need to have a follow-up vaccine every year, both because maybe the immunity will diminish and also maybe to cover variants that pop up. That's being studied right now, more to come. But for right now, the idea is get the ball rolling.
Right, and just anecdotally, both Kemi and I are about out 6 months, and some studies that have been done with people who have been vaccinated, as well as people with convalescent plasma, are showing that for survivors, it's probably fair for about 4 months that they'll have adequate antibody titer, although it's unclear what level of antibody titer is protective. And for people who've had vaccinations, it looks like it's probably closer to a year, but still this is ongoing research. So until someone can definitively look at all these numbers in a large population, it's really hard to tease out.
I just wanted to add quickly that I'm still in the study as an open label. So now that I know that I received the vaccine, I'm still going in, and I will be going in another week or so, and they will continue to gather data from those of us who've had it for the longer period of time than others.
And the final question that I'll take myself that's in the chat is, how about chronic high blood pressure? Well, I think a number of the people in the trial, I mean, I certainly have high blood pressure. It's been around for a little while. And I think I'm doing okay. They'll be looking at these issues over time within the trial, and also with the several million people who have been vaccinated. But I don't think high blood pressure is going to be one of the things that precludes getting vaccinated over a long period of time.
A large percentage of the participants in the trials had high blood pressure.
So that's a good question. I do know the ethnic and racial breakdown. And I know that their goal was to have about 20% have underlying conditions, but it was sort of a mixed bag of people with high blood pressure and a lot of other things. I would say it's probably likely 5 to 10% of the people in the trial, but that is just kind of guessing based on the
That
overall
had high
numbers.
blood pressure, at least 10%. Yes.
Yeah.
Yes.
And now that 50 million people have been vaccinated, I'm sure that especially over 65 being a priority group, I'm sure probably 5 million people with high blood pressure have been vaccinated in December and January. So to wrap up, since I think we're a little past time actually, but it's easy to sit here and answer questions and talk probably for a very long time. So I'll artificially respect everybody's time and say that we should end. But this has been a wonderful forum, and I would like to thank everybody and all the support staff of the Meyer Cancer Center and the community engagement, and also my panelists, Dr. Babagbemi, Dr. Easterling, Dr. Morales, for being here, and Rosia Ramos, who's there somewhere, who seemed to make it all happen and make us all be in one place at the same time doing this. I would like to thank everybody for doing such a wonderful job. And within the chat, I think everything's been sent in terms of follow-up information and emails and contact. We would be thrilled to hear from you. So thank you very much.